Atrial fibrillation is a situation where multiple areas within the atria are going off all at the same time instead of the one location that is our natural pacemaker leading the charge. This leads to an erratic heartbeat, both in terms of rhythm, but also in terms of the actual speed at which the heart goes. It can go much faster than typical and be a lot more irregular. So the symptoms that patients will have are typically shortness of breath, loss of energy, palpitations. These can be somewhat nonspecific alone, but in concert with each other, these often denote a problem with someone's heart rhythm.
Atrial arrhythmias, or a rhythm abnormality, most often are treated by cardiac electrophysiologists. Some arrhythmias, particularly atrial fibrillation, are very frequently treated with surgery. Oftentimes we can treat that at the time of open heart surgery. For example, if someone who needs valve replacement or valve repair, we can do a concomitant atrial fibrillation ablation at the same time. Very frequently these days we're also doing ablation through less invasive approaches, either through a small incision below the breastbone or with an endoscopic approach where we go between the ribs. When surgery is done for atrial fibrillation via open heart surgery, the recovery is the same as any other open heart surgery patient. It takes about 6 to 8 weeks for full recovery from the operation. Oftentimes we can do Afib ablation through less invasive approaches, and the recovery from that is generally faster. It still takes about 2 to 3 weeks for the incisions to heal, so we ask patients to limit their activity during that time so they can heal properly. Following that, they can get back to normal activity as tolerated. It's also important to know that after surgery for atrial fibrillation, the heart rhythm may not go back to normal for a period of about 2 to 3 months until the inflammation around the heart has settled down. So the most important reason to have your atrial fibrillation treated is that many patients have atrial fibrillation that's undetected until the first symptoms occur, and those symptoms can oftentimes be a stroke. So it's quite important to treat the Afib even for patients who are asymptomatic.